Why is it important to check for the signs of scoliosis? The only way to know if you have scoliosis is to be assessed by a medical professional. And scoliosis is typically diagnosed through a combination of a physical examination, taking a patient's family history and their medical history, and then looking at any x-rays or imaging that may be performed as a result of those examinations and histories. Now, knowing where the condition is and knowing the signs that are associated with scoliosis early can lead to early detection. And early detection can lead to proactive treatment. However, this is only associated if you're choosing a conservative treatment option that will dictate treatment early. Unfortunately, many times early detection leads to no treatment at all, and curves unfortunately can worsen because we know scoliosis is a progressive condition and it's its very nature to worsen over time. Scoliosis starts with in a mild state. We believe all curves start off relatively mild, probably somewhere around 5 or so degrees, and these mild curves progress to moderate, severe, and even very severe. And as this condition progresses, it typically leads to more outward noticeable symptoms, and this progression is typically associated during growth, with classically pubescent growth spurts that occur in adolescent stages. So therefore, if we find scoliosis early, it means that we can start to treat the curve before it starts this progressive nature, and therefore we know we can have greater impact on the curve progression. There's never treatment guarantees when it comes to scoliosis, but we know smaller curves always respond better to more conservative options than more severe curves. So therefore, treating curves early in the progressive nature makes sense. However, in order for us to actually find scoliosis, you need to be able to recognize the signs and then be able to diagnose it with imaging. So therefore, finding scoliosis through other means other than imaging is an important factor. Now, when we look at scoliosis, the first thing we have to understand is scoliosis is a condition of spinal asymmetry. It's where we have curvatures in the spine that are associated with rotation. And these curvatures lead to uneven forces throughout the body. And therefore, in children, the earliest sign of scoliosis is posture, is what you see. It's uneven shoulders, uneven hips, uneven waist, the body extremities hanging at different lengths. It's normally not associated with any type of pain or discomfort. Kids won't come to you saying, oh, my back hurts or my spine hurts. And unfortunately, a lot of times postural problems are not taken seriously in children, and the curve can worsen during growth stages. And the kids very rarely complain of any functional problems in the majority of cases. Now, in adults, it's the exact opposite. They may have some types of postural findings that you would see, but what normally brings on the diagnosis is back pain. The patient's complaining of pain or some type of pain that radiates into the extremities as a result of some compression to the nerve tissues that exit the spine. They'll get an x-ray and they will see the scoliosis on an x-ray. Even though there's postural findings there, and for whatever reason, the number one reason that brings on the diagnosis in adult cases is pain. In adolescents, it's going to be postural evaluations. Now, like I mentioned, the benefits of early detection means that we can treat curves smaller. And by treating curves smaller, this is when they're most responsive because the curves are smaller. In addition, curves are also more flexible. We know as curves become bigger, they become more rigid and more stiff. And as curves become more rigid and stiff, they become less responsive to conservative types of treatment that are non-surgical. So when we look at scoliosis screenings, when should they be performed and when should we most consider to do them? Well, normally, since we know in adolescence, curves progress during growth, and most likely they progress during rapid growth spurts during puberty. And so therefore, for girls, this is somewhere between 10 and 14 years of age. For boys, this is between 12 and 16 years of age. So we want to do these screenings before this actually occurs to find it. However, since there is a wide age gap, anywhere from 10 to 16 years of age, if it's a male or female, you can see it'd be hard to screen all these children every single year during this age to see exactly what's going on. So even though scoliosis screenings still occur in some schools and some states, a lot of times the screenings have been pushed aside, leaving the idea to find scoliosis in its mild form up to the parent or a caregiver or even their pediatrician. So a lot of times patients are not diagnosed. And if we think of how often patients during their adolescent stages go to doctors, they typically get a pediatric physical once a year. And a lot of growth can happen during a one-year period of time. So they can have no diagnosis done, have a significant amount of growth over 12 months, and go back next time and actually find a severe scoliosis. And the whole mild evaluation was completely skipped because they grew right through and progressed right through that stage. So therefore, I definitely recommend, if you are a parent of a child that's going to go through puberty, that you check your child's posture regularly. You look at them every couple weeks to every couple months. I mean, you don't want to go 6 months to a year, and looking for shoulder imbalance, looking for rib asymmetry, looking for waist asymmetry. There is never a time that asymmetry is normal in a child while they're growing and developing. And if there's any type of a postural finding, you should definitely take your daughter or your son to a doctor to be further evaluated to see if there's any type of scoliosis occurring. In the adult case, if you're experiencing any type of pain in your spine, you should have an image performed to see if there's any type of scoliosis. Now, unfortunately, in adult patients, a lot of times scoliosis is discounted because adult patients are normally not treated for scoliosis until it becomes very, very, very severe, meaning plus 50 or 60 degrees. So many times patients are just given medications and injections, and they're treated for the symptoms of the curve while the curve is still worsening. Unfortunately, curves in the adult form tend to increase the rate of progression as the person gets older. And somewhere between 45 and 60, there tends to be an acceleration of progression. And at this stage, curves can start progressing faster again. So the most critical times for rapid progression is in adolescent stages while patients are growing, and kind of in this later midlife, somewhere between 45, 50 years of age and 60, we tend to see an acceleration. In both these stages, we want to treat the curves before they worsen, because treating it earlier means better results. And this is what we really focus on here at the Scoliosis Center, is that once we have an x-ray confirming the diagnosis, then our next goal is choosing what type of treatment approach is best for you, whether you're looking more at a traditional surgical approach or a more conservative approach that's going to be focusing on a more natural approach and reducing the size of curvature. Thanks for watching. I hope you found this information helpful. If you have any questions about this topic or other scoliosis questions, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish new videos just like this.